5:00. Fees paid to GPs and pharmacists for state services are to be cut by around 7.5% to save €70 million a year. These cuts are being introduced by Minister for Health James Riley. GP fees will be cut by 7.5%, saving €38 million. For pharmacists, the reduction is 7.6%. It's going to save €32 million in a full year. The cuts are being introduced under the Financial Emergency Measures in the Public Interest Act. Now, the Irish Pharmacy Union has described fee cuts in state payments to pharmacists as mindless and self-defeating. The Irish Medical Organisation warned that patient services at GP practices across the country will be significantly affected this winter as a direct result of cuts to GP fees and allowances by the government. Dr Ray Wally, who's the chairman of the union's GP committee, spoke to Morning Ireland.
The cut of 40 million in a year follows on from 124 million of cuts in the previous 3 to 4 years. If you examine what the funding of general practice is in Ireland, it's 2% of the healthcare budget. Within that, we provide 90% of the consultations on a same-day basis. The contract we have is for 24/7 care. The similar contract in the UK is for 9 to 5 care, of which they get 9% of the healthcare budget. At the moment in England, it is a month to get an appointment. So what is going to happen here is we're not going to be able to cope with the workload considering the resources being provided to us.
Because you're being paid less to do it?
Well, the money that we are being provided with are gross figures. They are turnover figures which cover all the costs of general practice, which are rates. Many of them are fixed, like any small and medium enterprise. So they're fixed in the form of rates, mortgages, utility bills. The only way we can cut back on our costs is to reduce the amount of staffing, be it hours or the number of staff, and as a result of that, services will be curtailed.
That was Dr Ray Wally speaking on behalf of GPs. Dr Darragh O'Loughlin is Secretary General of the Irish Pharmacy Union. He's here with me in studio, and you're very welcome. Now, Darragh O'Loughlin, for pharmacists, the retail markup for drugs dispensed under the Drugs Payment Scheme and the Long-Term Illness Scheme is going to end. What is the markup you enjoy at the moment?
The markup paid up until now on those particular schemes has been 20% above the wholesale price of the medicine. The bulk of dispensing done under the state contract already is the General Medical Services or Medical Card Scheme, and that has never had any markup on it.
So this ends for you now. What are the implications for you? I mean, you've used very strong language. You've said that the decision by the Minister, the cuts, are mindless and self-defeating.
Yes, because every time money is cut from payments to pharmacists, it reduces the capacity of pharmacists to provide additional services to patients. This government came into office with a view that they were a policy that they were going to deliver more healthcare services at what they called the lowest level of complexity. That means that work currently being done in hospitals could be done by GPs, work currently being done by GPs would be done by pharmacists, and so on. By withdrawing resources from pharmacy and from the pharmacy profession, they're making it less likely that we'll be able to provide the services.
Why does it reduce your capacity to deliver services?
At the moment, the only service for which we're paid, or the bulk of our payment, is for dispensing medicines. Other services which pharmacists provide out there are not paid, but patients benefit from them.
Like what?
So, consultations with patients, spending time with them explaining how to take their medications. If you have a pharmacist employed and that pharmacist is spending time with elderly people or people who have started on complicated medicine regimes, it costs money to provide the counselling and the advice and the support that's there. It has always been done. People who need that attention get the attention. That has never been remunerated, and that's because pharmacists could afford to do it on foot of the payments for dispensing.
You would argue that that is the normal interaction that happens in a pharmacy between pharmacist and client as they come in to do business, that is part of what you do.
It is part of what we do.
That you would even expect payment for.
There's a very clear distinction between telling people briefly what their new medicine is and how to take it and wishing them well, and actually sitting down for a full consultation with somebody, interacting with them, gaining an understanding of how much they know about their condition. In other jurisdictions, such as the UK, pharmacists are engaged in what's called medicine use reviews, for which they are paid, where patients who are elderly or on complicated medicine regimes actually get a 15 or 20 minute consultation with a pharmacist who explains what every medicine is for and then evaluates whether the patient is taking them correctly and whether they're getting the benefit from them. The UK government can see the value of that, because if you get patients to understand their medicines and take them properly, they're significantly less likely to end up in hospital. And one 24-hour period in hospital costs the state about €2,500. So therefore, the British government has worked out that it makes sense to pay pharmacists a very small fee to try and avoid the patients ending up in hospital. Likewise, they have services such as a new medicine service, where if you get commenced on a new medicine which you may not understand, the pharmacist again sits down and engages with you and follows up after about 10 days with you.
How much time do you believe that a pharmacist spends interacting with a client at that level?
Well, it's not about belief. I am a pharmacist and I run my own pharmacy, so I know that some patients demand a great deal of time and they always get it. There are people who could take 20 or 25 minutes of your time so that you can be absolutely confident that they know how to take their medication.
But it's good business practice, isn't it? It's a good consultation with a client and they continue to come back to you. And when they come into your pharmacy, they buy not only the medicine, but they will buy other additional materials you have in your shop as well.
The majority of people who come in for prescriptions now, because the way the economy has gone, are not buying anything else. We have 2 million people covered by medical cards in the country, where it used to be 1.2 or 1.3 million, and that's because people are undergoing financial hardship. So the reason pharmacists engage with patients is to try and ensure the patient gets the best out of the medication. It's not because they hope the patient will buy something else in the pharmacy. That's not why you go out engaging with somebody.
So the Minister is cutting and it's a 20% markup that's going to go. You say it's mindless and self-defeating. What's the alternative?
The alternative is to do what we have been calling on the Minister to do for quite some time, which is to sit down and engage properly with his own health strategy, put the health strategy on the table, let us come to the table so we can explain what parts of that strategy, in terms of chronic disease management, in terms of health screening, in terms of preventative medicine, that we can deliver. Pharmacy is the most accessible part of the whole healthcare spectrum, and the Minister has a strategy to try and push healthcare out into communities. We haven't had an opportunity yet to engage on that. All we're getting is this series of cuts. The cuts to pharmacy payments in the last 4 years amount to 570 million before today's cut is taken into account. And what we're saying is, rather than sitting back in an office and administering these cuts on an annual basis, he should talk to us about what parts of his strategy for patient and healthcare in this country that we can deliver.
Well, what parts of his strategy can you deliver without perhaps having a turf war with the GPs and muscling in on their territory as well?
Well, I hate to think that anybody would perceive healthcare as a turf war. I don't think a patient is a prize to be fought over. Every one of us has our own role to play. At the moment, people are attending hospital for appointments that could easily be dealt with by GPs, because GPs have the training and the knowledge to do that. But they are currently swamped. According to themselves, their workload is such that they can't take any more on.
So in
pharmacy, we can do. Last year and the previous year, we demonstrated that we can do flu vaccination, for example. That's been done now for 2 seasons very successfully. We get paid a fee of €15 per patient, and we're doing it. We're delivering emergency contraception in pharmacy for about the last year and a half, which previously was a prescription-only service. In other countries, such as in Canada, pharmacists are involved in monitoring people's condition, such as blood pressure, and then tweaking their medication, nudging the dose up or nudging the dose down according to how well the blood pressure is controlled. We can work with patients on their diabetes control, and other chronic diseases, where it's all about controlling the symptoms to prevent downstream complications.
Have you had any engagement with the Minister or with the GPs on expanding your role?
When this government took office in 2011, we had a very good initial meeting with the Minister, and we explained what we could do to help deliver on his healthcare strategy, and he seemed quite enthusiastic about it. We thought that from that we would be getting into some talks about the practical implications of this, what we would literally be doing. We got the vaccination and we've had nothing since.
In the meantime, the 7.6% cut is going ahead. What are you going to do about it?
We are going to absorb it. Individual pharmacies up and down the country will look at their own business plans and they will make adjustments as they need to.
Do you think pharmacies will close arising out of this?
I think that many pharmacy businesses are on a knife edge. It's hard to say what would prompt it and what wouldn't. I'm not in here saying the sky is going to fall down. I can't predict how many pharmacies will or won't close. What I do know is it makes life increasingly difficult for a profession in a sector that's already under huge pressure.
Darragh Secretary General of the Irish Pharmacy Union.